Hi everyone, my name is Ep13 from Unravel Biosciences, and welcome back to another episode of Unraveling Rare. Today we have an episode which I think will be very valuable and interesting to many of you. We have Christal, who is a mom and a caregiver, and whose family participated in a rareSHIFT program a while ago. And in the last 6 months has had her son taking a compound that we predicted off label, and since then has been tracking his process all throughout this past 6 months. So, with that said, Christal, I would love for you to introduce yourself, both personally and professionally, and talk to us a little bit about your family and about Malan syndrome.
Yes. Hi, Eleni. It's so nice to spend some time with you today to tell you more about our story. I am Christal Delagrammatikas. I am the mom to two boys. My oldest has a very rare genetic overgrowth disorder. Malan syndrome is a disorder that can present in many different ways. It's a spectrum disorder, but some of the more common features are overgrowth. And what that means is that children tend to grow at a more rapid rate. As I mentioned with Yanni, my son, they children can have global developmental delays, skeletal abnormalities, scoliosis being one of the more common skeletal issues, vision impairment. Um, Children and adults can go on to have seizures. Some are diagnosed with epilepsy, and behavioral challenges are a big part of the disorder.
Could you please describe your family's journey through the RedShift program? And if you could also talk a little bit about the outcomes that came out of the personalized study that you participated in?
When Yanni started going into puberty, we saw more challenges. We dealt with more challenges as he got older. One of the things that was becoming more and more hard to deal with was his behavior, and it was affecting things like being able to go to school, being able to get out into the community, being able to spend time with friends, things that he enjoys doing. But because of his anxiety and his inability to regulate himself, these are just hard to do, pretty impossible sometimes. And it was really affecting his quality of life as well as ours, just because our family unit just couldn't get out together as much as we had hoped, or wanted to as a family unit. So, other things that he was starting to deal with as a teenager was weight loss. He had, even though he was growing taller, he wasn't keeping up weight wise. His weight was actually dropping, and so he was creeping into the low BMI, which was very concerning. And along with the weight loss, we were also seeing some skill regression. So things that he had once done very well, we were noticing that he was having more difficulty with, like balance and coordination. He was complaining of being dizzy more often. His activity was really slowing down. He would spend days just on the couch and really refuse to get up. Sometimes he didn't even get out of bed. For behaviors, we had trialed upwards of, my goodness, close to 10 different medications, and nothing really helped. It was a lot of trial and error. We were basically treating the symptoms, but the go-to drugs that treat those symptoms were not helping in this case. And so we learned of Unravel, and I am a scientist. I have a background in neuroscience. I'm a full-time caregiver. I left my academic career to become a full-time caregiver, but I really like making decisions based on data, making informed decisions. We were presented with a list of drug predictions from rareSHIFT, and from that we identified a few compounds that we felt okay exploring, and we worked with our team of doctors. Based on the team decision, we went ahead and tried one of these drugs, and it was a drug that is used in the pediatric population, has a good safety profile, and we started Yanni on a very, very low dose to measure any changes in symptoms after he started the drug. One of the big things for us is behavior. Again, that's been the most challenging thing and the most impactful on Yanni's life. So we picked a validated standardized assessment for behavior. And I completed those assessments at a certain time interval after, like when Yanni started the drug, and then a month, 3 months, and 6 months. So regular time intervals after starting the drug. I also looked at things like behavioral episodes. And I kept a good journal of those episodes. So I was really recording what those episodes looked like, how long they lasted, how often they occurred each day. And I did that from the time he started the medication until we concluded the study, which he has just completed. And during that time, we did feel that we were seeing improvements based on what the data was showing us and how we felt overall. Just we just felt like things were a little bit easier in managing his care.
Could you also speak about some improvements that you have observed in Yanni?
Yanni's a very complex kid. In my tracking of his behaviors, we were seeing that he was having less frequent behavioral episodes, and they were shorter in duration. So it didn't extinguish the behavior, but they were definitely fewer and shorter, which was really nice to see. And I would also talk to my husband, who provides a lot of my son's care as well. He's very involved. And he also felt like behavior was improving. Some of the other things that we really noticed was that, and we didn't expect that we would see improvements in this area, was his sleep architecture improved. So Yanni was having a lot of trouble getting to bed, one, and then actually once he was in bed, falling asleep. So our whole bedtime routine with him could take hours, and we were noticing that when we asked him to get ready, let's get ready for bed, he would get up and go up the stairs, and so showing fewer refusals. And then once he was in bed, he was falling asleep faster. His activity has improved, his balance and coordination. He's getting up more. So with this medication, he has put back on weight, and he is now, if you look at his growth chart, he is back up to where he should have been a few years ago before he started dropping off. So that's really encouraging as well. One of the things we did notice was that he loves using his iPad device, and we just recently put on Kids Messenger, and he was really focusing on that and trying to communicate with texts. And Yanni doesn't read or write. He can't identify words of meaning, but what he really started to do was trying to spell words for the first time. So I think in this period of time, we really saw improvements in his ability to text functionally and to text a message that makes sense. So that was kind of cool.
And with all that said, do you have any messages, closing thoughts, tips, or advice for other parents who want to track progress in their kids as well?
Yeah, I think you need to first identify what is important to your family, like what would truly make a difference in your child's life and in your life. And I would encourage validated assessments that are tools, essentially, to measure the symptom that you're trying to track, and be very consistent with how you take those measurements, whether it's every day or every week, or take those data points when you've decided to take those. I would also work with your team of doctors to make sure that they are on board with the medication. Make sure that you have a team that will be open to reviewing research-based information and helping your family to better understand what those predictions may mean. What are the side effects? What are all the different things that need to be considered? Yeah, I think that rareSHIFT is another tool, and I think especially when your child is affected by a rare condition and there aren't medications, or there isn't so much known, just like Malan syndrome, it's only been identified for 15 years, so there's just not a whole lot of information out there. And so these types of approaches can be very helpful. And in our case, we are seeing improvements, and just I'm glad that we took the chance to explore this approach.